All right. We're live.
Hey Sharon, how are you?
I'm doing good. Yourself?
I'm doing great. I'm in Vail, Colorado. The weather is about 15 degrees. The boys are out snowball fighting, so doing great.
I have a little bit of an envy, but the trip to Vail, I might have been a little bit much for me, but I'm
True,
glad
since
you're doing great.
you just got over your flying fears. We'll take it like hour by hour. Right now you're
That's
about a
right.
2-hour flight. Yeah, yeah.
That's right.
All right. Well, Sharon, let's dig right in. So today
Yes.
we're talking about complementary and integrative medicine. And I
Yeah.
just want to frame a little bit of what we're about to talk about because it is a hot topic. I mean, I
hmm
feel like it has been a hot topic.
hmm
You mentioned, which I want you to maybe expand a little bit about, that you were reading or listening to people like Suzanne Summers, who touts a lot of things, from decades ago about chemotherapy, radiation therapy, et cetera. And I think it fits perfectly on the spectrum of what patients experience, where most oncologists are kind of touting evidence based medicine, chemo, surgery, radiation, hormonal based treatments. And then on the other side, you have these people with lived experiences that are touting, you know, beet juice and lime juice and teas and all these types of things. And so like as a patient, you're like, where do I fall in the middle? So today we're going to go over two studies and maybe some lived experiences. One study 5 years ago, ASCO published this national survey of about 5,000 people, mostly caregivers and people living in rural America who are affected by cancer. And the backbone of this study was interesting because it was about how people are struggling to afford cancer care. But 4 in 10 of those people believed that they could be cured through solely alternative treatments. So they wouldn't even need to go to experience an oncology center or surgery center, radiation center, et cetera. This would include things like diet, oxygen therapy, vitamins. Um, and so that was really interesting. And then just a couple of years ago, there was a really cool thing ASCO did where they surveyed a little bit, I think it was like about 125 or just under doctors, oncologists, and then about 150 patients, and almost asked a singular question. Do you incorporate complementary or alternative treatments in your care? And the patients said 73% of the time, yes. And the doctors thought the patients incorporated these things about 40% of the time. So a huge
Yeah.
gap in what people are actually doing versus what doctors think that they're doing. And for patients, one of the or two of the biggest or the treatments with the greatest benefit they listed were Tai Chi and acupuncture. And for the doctors, they thought patients would benefit the most from diet, exercise, psychosocial support. Interestingly, not as much spiritual meditation or mindfulness support, but that was just a really big disconnect. So let's dive in. Let's maybe dive in with your experience as a recently diagnosed breast cancer, early breast cancer. Now you're in survivorship, and you had in integrative oncology embedded in your treatment. Maybe talk to us a little bit about how that was introduced and how you received it. And maybe the biggest question here is, did you even know that this wasn't part of standard of care therapy or offering for most Americans diagnosed with cancer?
Yeah, that last piece, I did not know it wasn't standard of care. I assumed it was because when my breast surgeon said, "Hey, I'm going to set you up with this integrative doctor," I'm like, "Okay," and radiation, okay, and I thought, "Okay, great, this is awesome." It was only when I began speaking to other cancer survivors at doctors' offices that I was telling them about this integrative piece, and they're like, "What?"
Yeah.
And I'm like, "Yeah, this other piece about how we should eat and how we should, take care of ourselves." And they're like, they had no idea.
Yeah.
But for me, it was a game changer because, Sarah, I think a little bit of this is cultural too. You
Mm,
notice in that study, there were rural people, right? So
yes.
people who are maybe more, living, maybe less educated, but also too culturally, I think too, in the African American, at least the Caribbean community, I know
Yes.
in my country, Jamaica, that standard of care is drinking soursop tea.
Mhm.
And that was a very big thing. Like, people there, that's where they turn to first. And they'll show you online where it says soursop juice, graviola, has 1000% more power than chemotherapy. And it's
Mm.
online. So when I was introduced to my integrative doctor, I said, "Hey, have you ever heard of soursop?" And she said, truthfully, yes, we
Yeah.
have. There's not enough research. And what I find to be interesting is that every time we talk about an alternative medicine or herb or plant or whatever, it's always the same answer. Not enough research done. And I'm thinking to myself, but it's been years. Why wouldn't we just do research for what we're doing, for these things? And one of the interesting things for me, when I was at my radiation doctor, the nurse said to me, I was asking her about these plant-based alternatives, right? Alternative
Right.
medicine. And she said to me, "Do you know that a lot of these medicines are
Of
plant-based?"
course.
I said, "No." She says, "Yes, they're using it in these medicines." So I know this is very controversial in this community, but the truth is there's a little bit of a distrust
Yep.
with patients and the establishment and people like Suzanne Summers. I mean, she's called a lot of attention to that. Like,
Yep.
listen, she's a 25-year survivor and she went non-traditional. Now she takes a
Yeah.
lot of vitamins, a lot of supplements, a lot of stuff, but she would do that any day, right?
Yeah.
And so for me, I do both. I did the standard of care, but I certainly look at my list from the integrative oncologist where it says eat this, don't eat this, drink this, take this herb, drink 4 glasses of green tea. I mean, I go by that more than anything else. Like,
Yeah.
I really changed my diet.
It's
I
so
really did.
interesting because everything you're saying is so true. And it's like from the patient perspective, there's that mistrust. And
Yeah,
then from the physician provider perspective, there's that mistrust too, because they've seen the extremes. They've seen
right.
people say and sell to the
Yeah,
most vulnerable, don't spend your money on cancer treatment, spend your money on this, venom or this juice or this whatever. And so it's kind of like these two audiences are experiencing the same thing very differently. But the reality is, at least in this study, only gives us a cross section of these patients. Up to 75% of us are doing it anyway.
we
So
are.
to me, I always think if I'm a physician and I'm in charge of helping you heal, shouldn't I know? Shouldn't I make myself educated in some of the more evidence-based things, or
Hmm.
at least be able to debunk some of the things that people may be bringing into the office, like, what if this, what if this? But what actually happens is patients aren't even saying that they're participating in some of these complementary or alternative based um, treatments. And that is very detrimental because there's a lot of side effects in
Yes.
crossing some of these things over. So we got a lot of work to do. And I'm really,
Yeah.
one thing I want to really call out is there's this world of complementary and alternative medicine.
Hmm.
There's this world of validated, there's actually a society for integrative medicine. And
Hmm.
out of that comes integrative oncologists. These are MDs or DOs trained in cancer care that then look into complementary and alternative therapies. So by no means are you getting less than when you pursue someone who's very aware of what's out there. In fact, like you're getting more. So,
Absolutely.
I mean, really, really, really interesting. But I'm with you in terms of, I mean, I manage a chronic disease, and I was just showing you, I'm drinking bone broth, girl.
Yes.
Like
Yeah.
I'm drinking bone broth. When my rheumatologist says we want you to take, this muscle relaxer or this thing, I'm like, I'm gonna just have some hot bone broth and give myself a little time for meditation, reflection, maybe some Reiki. doctors, even when I talk to my own doctor about it, she laughs. She's like, okay, whatever floats your boat. But the reality is I'm living an experience. You're living an
Yes.
experience.
Yes.
And we want to do what's best for our body. And sometimes that doesn't feel like all of these toxic things that we have to take. But sometimes that is what's healing us.
Right.
So there is a balance there. But very, very interesting stuff. Okay, last thoughts on it, Sharon.
Something that you said I thought was just really true. You said that doctors, we have a lot of work to do. And of course, that's what our company does, right? We educate. And one of the things you said, doctors need to really open their mind as to what we are doing, right? To have a more open mind. And I think that's something we want to definitely keep pushing with our doctors. Like, okay, we're doing this anyway. You might as well know. And I'll never forget my breast surgeon saying to me, Sharon, you're going to become best friends with green tea. And I'm like, wow. She's like, it's going to be your best friend. Okay. I'm going to drink 4 cups of that every day. That's before I got to integrative doctor. That was my breast surgeon. And so and now I'm seeing all the benefits of green tea. So I like that she was cutting edge. Like she was aware. She knew about the others complementary stuff. Yes, we had to cut the thing out, but she was also aware of what was going to be needed for the follow-up care. So we have work to do, but total health education, total health oncology is here to do the work. And we are.
And we're here to talk about the things that are happening in real people's lives. Yes. I want to leave a final thought. And Sharon, I know you, and I know you're going to go straight to Google when I say it. But actually, that's what I want. So for our whole listening audience, Memorial Sloan Kettering Cancer Center, one of the world's top cancer centers, actually saw a need for just what we're talking about.
Yes.
And at least in some small way, they put out for providers and patients both a resource called About Herbs.
Yes, I love it.
Girl, okay, you already know it. Listen, if you're a patient of any type of disease, cancer, autoimmune, any type of disease you're living with, and you're like, oh, I'm going to try this thing, this herbal supplement, this vitamin supplement, please, I urge you, Memorial Sloan Cancer Center, Google About Herbs, find there, and you could search almost everything under the sun, and it will talk to you about interactions. It will talk to you about benefits. It will talk to you about cautions. And I find it so helpful because that's something I can use to take into my doctor to say, hey, I was reading on the benefits of whatever, and it's from an extremely reputable source. Mm-hmm. So it almost disarms the doctor a little, lets them, or unarms the doctor, whatever my word is supposed to say, lets them realize that you're doing the work and not just taking things that people are saying, but really looking at, what could help your body and what could help you heal.
Amen. That's right. I'll find the link and post it in the comments afterwards. But that is, I was turned on to that by that integrative oncologist.
Okay, Sharon, give us something to leave our Monday inspired and happy.
Okay, so what I did with the team meeting this morning, I reminded people that we're so hard on ourselves that we fail to talk about what's good about ourselves. But what I want to leave you with is to look in the mirror and celebrate your superpower, because everyone has a superpower and you should know what yours is, and own it and celebrate it.
Own it and celebrate it. And like Mel Robbins says, when you look in that mirror, give yourself a high five.
There you go.
All right, girl. Loved being with you today.
All right. Have fun. Enjoy. It won't bother you this week. Okay.
Thank you. All right. Talk soon. Bye.